now. So it's 2:01 and I'm starting the recording. So thanks for your patience. I just want to make sure that I can be heard. I haven't had anyone say they can't hear me. Um, so thanks for your patience as I get to learn how I've done the recordings before and shared them before, so I know this can be done, but we'll have to get the right format to the VSSNA where this will be posted. We'll try to get it in a format where it can also be shared by email, because many people, not everyone's available now. They're working at other work or at school. Again, I'm really grateful for our professional nursing organizations. Just their resources alone during COVID-19 has been worth the membership costs to save my nursing practice and to support you all. The VSSNA has stepped in with an even stronger presence with the school nurse advisory team during this time. The objectives for today, are really so that you have a platform to feel where you can get a little bit more knowledge, more knowledge about topics, more resources, or maybe eventually a platform where you can feel comfortable sharing and discussing as well. Our goal for the school nurse advisory team with VSSNA, VSSNA has always been involved with the school nurse advisory team, but now there's a larger presence. But our goal for COVID-19 is that so that you folks, school nurses in the school every day, will feel empowered to function their full capacity of their RN license in support of school and community mitigation efforts. So we're going to be on the same page by reviewing a few notes from Dr. Brina Holmes and some of my own slides, kind of the basics of COVID-19. But before going on, I really need to share a personal reflection. As RNs, we work so hard to fix things and help everyone else heal that sometimes we get stuck on perfection and doing things right. There's no perfection during this time, and we're already doing the right thing. We're using our science and our knowledge and working to the best of our capacity, but it's hard and it's not black and white. Yesterday, after my leadership meeting with my national colleagues, we took time to check in with everyone to see how they were doing. It was really heartwarming and heartbreaking at the same time. After listening to everyone, I was so moved by their comments that I couldn't share my own, nor move the meeting forward right away. It was at that point I kind of realized that this check-in that I had set up uncovered a rock in front of my own heart. And that's something that we as professionals need to do for one another, either in our small groups or with your own local networking or with a close friend. But let's focus on what we can do for each other in our school communities, and my hope is that we will get to a more informal check-in format eventually. Again, if not this format for you, then at least in your regional format. Maybe we could do regional meetings. I'm going to move to the next slide. This is a really big thank you to the VSSNA. They've been amazing. They'll probably share with you more about the position statement that they worked with at the state level. They've been putting in extra meetings and their website. It's amazing what extraordinary talents does our former Navy man and school nurse have. Clayton Wetzel's been doing a lot of the technology pieces from their side, though this Skype is a state product. Not only did he manage all of the technology for the last webinar, but answered as many questions in evidence-based detail as possible for the questions that we couldn't get answered during that past time. This is where this webinar will end up on the VSSNA website, along with the other great school nurse resources that they put on. for the questions for today, hopefully you sent your questions to the COVID-19 VSSNA email, and you can also write them in the chat box. And someone says, unmute me. Okay, unmute Soph. Let me do that before I go any further. And let me find Soph. All right, if you're on the computer, your name will show up. And there it is. Okay, so Soph, you're going to have to go to the little phone image on the bottom right hand of your screen and click there, or you're going to have to press your space bar when you speak. And those people on the phone, when they speak, will have to do *6. So as far as questions that you have, please write them in the chat box. We will be able to save all of the chat questions so that they'll be captured. And I'm going to turn this over to President Soph Hall, Becca McRae, President-elect, and Clayton Wetzel. And I think I'm seeing unmute again. So you'll have to go to the, have you tried the space bar? Is somebody speaking? No? Click on, okay, it works for others. Oh, I'm hearing somebody. So we've got some other screens here. So in your bottom right-hand corner, there's a picture, an old-fashioned image of a phone, and that's where you'll need to click there, and there's a speaker icon, and you either hold it or you click on it, and it should let you come on. It's pretty clear, so it's still not working, it seems like. When we use Skype in other settings, that does work. Let's try something else. Let's see, stop recording. No, pause recording. I'm going to pause the recording. Okay.
Thank you, Sharon Lee. This is Clayton. I think that if you've unmuted everybody, if everybody can just go back on, and it looks like, I'm just looking at the list, and it looks like almost everybody's still muted, which is awesome. So if you notice that your microphone is not muted, just please make sure you mute from the bottom middle of your screen with the microphone icon.
Thank you, Sharon Lee. I want to thank the Department of Health, who is hosting this Q&A today for our school nurses. This is Soph Hall, the president of our Vermont State School Nurse Association. And as you know, Sharon Lee is our school nurse consultant. I appreciate you inviting VSSNA to speak with your participants for a moment. I'd like all of you school nurses to know that your VSSNA executive board has been incredibly busy since this COVID epidemic has begun. One of the things that we worked very hard on and are very proud of is a joint position statement that we as Vermont State School Nurses entered into with the Vermont ANA, the Vermont Nurse Practitioners, and the Organization of Nurse Leaders for New England, pretty much. Responding to the questions and concerns of nurses and school nurses. And we are very proud of this partnership and look forward to where it can go with us and for us as we move forward in the future. Also, the School Nurse Association has been very actively involved in assisting Dr. Chen in the surge planning. Unfortunately, that will probably be coming. We'd all like to think that it won't, but planning for it and hoping for the best is always planning for the worst and hoping for the best is never a bad direction to go in. So VSSNA will be working with the state, the NEA, the Vermont Superintendents Association, and the Department of Education for those school nurses that are members of NEA or on teachers' contracts as we move forward with that. Also, if you have not had a chance to input any questions, please do that now. We are monitoring the email COVID, I forgot exactly what it is, COVID-19.
It's COVID, COVID-19 at vssna.org.
Thank you, Clayton. Please do put your questions there. We are monitoring that, and we will pose those to Sharon Lee as we get to the end of this, her presentation. So again, thank you for being here, and thank you for all that you do.
So you're very welcome. And thank you for introducing the health department and for introducing me, which I didn't do. Clayton, I put the COVID-19 email. Would you just confirm that I typed it in correctly? All right. Well, thank you again. We know that our true heroes are out on the front lines, those serving food, delivering learning materials, working in healthcare settings, medical offices, in our grocery stores, those in gas stations, pharmacies, truck drivers moving equipment and PPEs across the country, and even bodies to temporary morgues. Because, please mute your, as a guest in the call, I'm going to try to mute you. I don't know how to do that, but please
Hi,
mute.
those of you that are listening, would you please mute yourself? There's a lot of us on this call and there's a lot of background noise. So please mute yourself.
Guest 259, if you would please mute your phone, that would be appreciated. Thank you. So some of you are, again, pretty used to the moments that I take at the beginning of presentations and meetings. Self-care is no more important than now. So I'm going to ask you to take some deep breaths and calm some of those autonomic responses that cause stress so that you can activate the system that calms you. If you would breathe, I invite you to close your eyes. If you would breathe in through your nose and out through your mouth. Let these breaths bring you back to this space, wherever you are, to honor your own spirit and zest for life. Bring yourself to these colleagues and to these topics so you're ready to use your nursing powers and be the super nurse that you are. So we're still leaning on this, whether we're open or closed, whether schools are open or closed, the school nurse framework. And again, thank you to the National Association of School Nurses for letting us use this. So the meeting format today, again, is a situational update. We can go over the details on the health department website. I'll touch on a few things because it has changed. Remember the Q&A. Right now, I'd like to move forward through content fairly quickly and save questions and answers for later, but keep putting them in the chat box. Okay, I'm seeing that, please mute, I hear papers. I see two calls, one extension 259 and one exchange 296. Please mute, I'm hearing papers. And again, just a reminder that you can contact us with any questions. We talked about the objectives. So this slide is one of the new features on the Health Department website. It can be a nice way to follow COVID-19 activities, but it changes really fast. 2 days ago, the top of the graph on the bottom right looked like a rate of disease was slowing. But in this graph 2 days later, it looks like the rate of disease is increasing. When you look at the numbers in blue, so my screen thumbnails are in the way. So down here at the bottom, and lost the slide. Down here at the bottom in blue is the number of positive tests. So that actually shows that the number of positives has dipped back down a little bit. The next slide, again, just statistics that I am able to access through the Health Operations Center and the State Emergency Operations Center, just showing that the number of N95, excuse me, the number of gloves has doubled in 2 days available, and the number of beds has increased available. It's increased by 50, and the N95 respirators has stayed about the same in this slide. Everything is changing so fast that what I share today is going to be different tomorrow. Just new this morning, I learned as I was making these slides, and I will share later, one of the things that we get, so there's approximately 200 calls or more a day to the 211 call center, which is separate from our disease center. People are beginning to be concerned about their neighbors or community members or other individuals who are reports of unsafe practice by groups and individuals, putting others at risk for COVID-19. Please mute. Thank you. So there's now a place to do that. You can go on the Health Department website. If you are concerned or you know of somebody who's concerned about non-compliance, either with business practices or unsafe practices, there's a link where a simple, very simple report can be made anonymously. So this is kind of funny. Obviously, this is influenza. We're all focused on COVID-19.
I'm on the phone.
Can you please mute your phone? Would really appreciate it if you could mute your phone. Thank you.
Apparently, someone noted on here to if you're on a phone, you can mute with a *6, and then to unmute, I believe it's also *6, if that helps.
Excellent. Thank you for that. So while we're thinking that all the disease we're seeing in the community is COVID-19, a significant number in these blue bars, heavy blue bars, are the current year. And yes, this information is a week and a half old because influenza is reported weekly. So the challenge with having COVID-19 and influenza, serious lung illness, means both patients are competing for the same healthcare system, and that's why this is such an important issue to mitigate COVID-19. The olive green line is 2017-18 year, so that's just a comparison. Just a reminder, healthcare providers are encouraged to proceed and order their testing for any symptomatic adult. They may begin to screen children just to study the epidemiology of the disease, but not because they are at high risk, unless they, of course, have underlying chronic health conditions. You know the same procedure. Contact their medical provider. Health department will notify patients and do an in-depth history of contacts, vulnerable contacts, at least 3 days prior to the onset of symptoms. Point of care testing. There was a lot of noise at the federal level about point of care testing and how we were pretty excited about that. It does not appear yet that there is a point of care testing system with significant reliability to put in place. The jury's still out on that. You already know this. This is a repeat, but it's really important, and it's good to have a chance to practice with that language and whatever, so you can help inform others. And I was asked last time, and I had to guess, and Dr. Holmes will tell us, as nurses, there's never the wrong answer because the information is changing rapidly. Just on Monday, the Association of State and Territorial Health Departments put out a position statement suggesting that close contact in the 6-foot circle for 10 to 30 minutes is now what's considered. So that's a new bit of information. There's not a health advisory out on that because it hasn't gone through the system and gone through the conversations that happens to vet information. I have to eat my hat on this one. These, again, are not personal protective equipment. And the day the information came out, I came home, or I was home. I took a new sock and made, with hair ties, and made a mask. So you can do, face covering. Dr. Holmes and Dr. Wendy Davis and others were reminding primary care providers just today at noon that we're trying to use the word face covering because this isn't about protecting ourselves. It's about I wear my mask to protect you, you wear your mask to protect me. And someone asked if these pictures were of nurses, and I might suggest that, well, would nurses be letting their hair down? We don't know who these people are, but are they practicing full infection control? Not necessarily, but hopefully they're avoiding spreading disease. So this information also is tied to child care providers, and we'll get more into that. In a later slide, I think I have moved them out of order, but in a later slide we'll talk about how child care providers can get access to supplies. So money, this kind of discussion is way too big for my brain, especially these days. I think the important thing about finances for Vermont is to know that Vermont is now approved for the federal public assistance funds in response to COVID-19. The declaration provides 75% reimbursement to state and local governments and some nonprofits for emergency protective measures, including, there's a list, but it says, I think I'll read this, nonprofits that could be eligible for reimbursement include nursing homes, laboratories, rehab centers that provide medical care, hospitals, emergency care facilities, fire rescue services, and education facilities. That was the point of my sharing that. And then the next one, the Federal Coronavirus Aid, Relief, and Economic Security Act. There is a specific pot of money for K-12 education. Pre-K is usually in a separate bucket. 90% of the K-12 funds must go to local education agencies, including school districts and charter schools. For a list of things, currently, activities required by federal law, education law, preparation, response efforts, school leaders, addressing inequities across populations, training and professional development on sanitation, minimizing spread of infectious disease, supplies for sanitation and cleaning facilities, planning for long-term closures, meals, technology, purchasing education technology, and other things. Funds will be distributed through Title I grant to schools. I don't have a lot more information on that, but that's how we get a lot of funding for schools in Vermont is through Title I. So just stay tuned. There's an awful lot we don't know at the health department. And questions like, schools, summer camps, what will the new normal look like? We just don't know. I did put some of the information from your questions from last week into some of the sections that we'll come to next. Okay. And I'm going to move past our scope of practice. So again, the VSSNA, I just really want to thank them from all of their work and thank you all for participating in the survey that we sent out, the Survey Monkey that I sent out about nurses who may be available or may be interested in participating in the surge efforts as an RN in special additional healthcare settings as the hospital build-outs for patients with COVID-19. So I was able, 173 of you responded out of approximately 300. 64% said yes or possibly interested, and only 12 of you were over 65. I was so impressed, which really bodes well for the VSSNA or the school nursing profession, just because, great, we need you there to take our places. Clinical competence. Some of you asked some great questions about virology studies and immunology studies. The Vermont laboratory is trying to, hoping to be able to do testing on immune response to COVID-19. Right now, from Dr. Brina Holmes this morning, she was suggesting that the immunity built up to COVID-19 is very erratic and does not necessarily guarantee prevention of reinfection. So that is still out. I wanted to say more about this. This is a document specific from Dr. Holmes. It's really the latest update on the science that we know and understand about COVID-19, and I apologize for not putting it in a more professional reference format. That will happen later. Again, another one, I'm just leaving this on because I think it was so well done, done by a nurse, and has a lot of high-level science for those of you who are interested. And here is a direct link to the incident command system for anyone who has the time to do that. So telehealth, that was a great question, and it depends on who is asking the question, or what do you mean by telehealth? If you're speaking telehealth by a licensed medical provider or someone who's providing medically necessary IEP work, then they have a different telehealth capacity, because that's been relieved in Vermont of almost, other than general common sense safety and privacy, telehealth is allowed to occur. But if you're speaking as a school nurse, a school counselor, or other specialized instructional person, you have to follow your school or your LEA's policy protocol on communications with families. So that is going to need more research if you have specific questions.
Sharon Lee, this is Clayton. If it's possible, the folks that are on the phone can't see your slides. So if you could share a little bit of what's on the slide and then talk, that would be really helpful.
Thank you. So what I've done is taken the components of the domains of the framework for 21st century school nursing practice. And right now I'm looking at, when I was speaking of telehealth, I was looking at the domain of care coordination. So I listed at the 3 priorities, getting medications and health supplies back to students and families so they can use them and have them during school closure. Interdisciplinary collaboration is just kind of part of our ongoing school nursing work. And then I was just speaking of telehealth as the third bullet. So thank you for that reminder. Can't do this kind of work alone. It takes a partnership, and you guys are awesome. I'm now looking at the domain of quality improvement, and I've just put 2 priorities, setting your goals for next year, participating in the national data set with the National Association of School Nursing. And I'm going to move to the next slide, community and public health and population-based care. And population-based care and all about relationships were 2 of the priorities that I have pulled out. And I'm going to share with you that I attended a national meeting virtually last week with the Healthy Schools campaign. NASNC, National Association of State School Nurse Consultants, is a partner with the Healthy Students Promising Futures. That's not written on the slides, but it's in my notes. Healthy Students Promising Futures is really a collaborative where state collaboration teams who use Medicaid in schools work together within the state to make improve access to health care for families in the education setting. It brings together some other national organizations, but it was the relationship. So the U.S. Appropriations Committee chair spoke to this group. Again, it was one of those big conversations with lots of numbers, way too big for me, about the appropriations for the CARES Act and for Medicaid. Vermont has been really fortunate in that Medicaid has been extremely responsive to relaxing or accommodating or adjusting to the needs around COVID-19, but specifically to this Healthy Schools, Healthy Students Promising Futures collaborative. It was really interesting to hear that the states who have strong relationships within their state with their Medicaid agency were able to move their programs forward much more quickly. They did talk about special education at that meeting last week. There was still no waiver for IDEIA, but they still want the best for all students. And I will speak to the random moment in time, which affects every one of you, unless you're in a private school or on the border school across the state of New Hampshire. So the Medicaid administrative claiming that you all participate in, states are using 2 options, and each state is in a different place as to what the final decision is, but the goal is to ensure that schools can still, even though students are not in the building, that schools can still recoup some of those reinvestment funds through the either through the random moment in time study for schools that are still not in session but claiming that activity, or something like an averaging of the second and third quarters, so that there would still be some reimbursement in the fourth quarter. For those of you who may not be, you're all participating whether you know it or not, but you might have a different level of involvement in this. So I apologize if there's too much in the weeds here. So I'm still in population health domain, but I'm looking at a slide that says schools and childcare programs, VDH, COVID-19. So just a reminder, that's the website has been updated. And I have 2 bullets underneath that, which are childcare health guidance that was updated this week. And then the second bullet is to sign up. So if you're an essential worker and you need to sign up for childcare, this is how you do that. The guidance around healthcare in childcare settings is kind of around these basic things, and you can open that and get into the details. But the daily screening of children and staff for fever, new coughs and colds in the kids, or cough and shortness of breath in the adults. The screener is to wear gloves eyeglasses as shields, and change their gloves and do hand hygiene between each child that they take the temperature for. The adults are expected to wear face coverings all day. And, of course, take them off to eat and things like that. There's lots of detail. Brina has done another one of her fabulous webinars with 2 different groups related to childcare, and that is recorded and available. This latest one will be available soon. The previous one is already online in this link that says schools and childcare programs. So this healthcare guidance document, again, we're not striving for perfection, but that document the first time around, it went through about 20 iterations, and then it goes to different agencies, and then it comes back and is finalized and then posted. So anything we do is the best for what we can do for that moment in time.
Sharon Lee, if I could just on this
Yep.
one slide, so there's a question, and I may have missed part of what you said at the beginning because I was trying to answer an email from somebody. One of the questions that was posted earlier was, I'm curious to hear your thoughts on the continued focus on taking temperatures of people who will not be in contact with others, will be wearing masks, or have no signs of illness, when this does not seem to be an early indication of C19. I'm sorry, hold on a second.
Excellent. Excellent question.
Okay, and then the last part is a poor use of RN resources during the school closure. So it's about the essential childcare, and does a school nurse need to be doing the temperature taking and those functions? Does it have to be a school nurse doing those?
Absolutely not, and thank you so much for bringing it up again. So the role of the school nurse in this setting, if you're in schools, this is for childcare. There are childcare going on all over Vermont. I'm on the hotline responding to all of those questions, and they have infants and up to about 12 years of age. So these are occurring all the time, and the majority of childcare settings are not in schools at all. So a school nurse wouldn't even be part of the formula. If your personnel in your school don't know how to take a temperature or need you to remind them how to wash their hands and take their gloves off or take their mask off, that would be an appropriate role, or if they have questions about a child that's ill or something like that. But no, that's not an appropriate full-time use of an RN. The RN, I'm not sure if that's answering the question, but so why are these masks and temperatures being checked when it's not an early sign of the disease, but it is an objective piece of data? And I think that is the key, and that question's been asked nationally, internationally, and state level across the board, including airports and everything. We all know that that's not an early sign of disease. Prodromal phase is, typically asymptomatic. But what we do know is the disease is shed for up to 72 hours. That's new. That was new information a couple of weeks ago, and they're beginning to suspect that the disease may possibly be shed sooner than that, none of which is in the symptomatic period. So you're absolutely right. Thank you for that critical thinking question around why take a temperature. It really, again, that's how do you put science, medical science, in the public domain? That's what all these questions are surrounding. But fortunately, childcare are really into child safety and hygiene, so they've been an easy group to work with from my standpoint. For supplies, Let's Grow Kids is an organization in partnership with, so I'm looking at a slide that says supplies for childcare. Getting programs, access to cleaning supplies such as gloves, masks, hand sanitizers is currently being coordinated by Vermont's Child Development Division and Let's Grow Kids in partnership with the State Emergency Operations Center. So there's a place on that Let's Grow Kids website to obtain more supplies. Um, okay. I'm looking at this next slide. It says leadership is the last domain. I'm going to move right on to recovery because I think that's, so I'm looking at a slide with a background of children, and I have recovery listed on one side and then a list of things: immunizations, access to care, basic needs, including nutrition, injury prevention, relationship violence, child maltreatment, social emotional support for families, access to education, and of course mental health is assumed in that social emotional context, and substance abuse prevention, etc. So those are some of the things to think about. What I've added here is just things, and I'm not going to play this slide, but just things to get you thinking about what could your practice look like if you had to do more with gowns and gloves. What would your practice look like if you had to train somebody to take a temperature of every person at the door before they came into the school building? These things we're just looking at, and CDC is already thinking about this, so there's already work being done. And in the state of Maine, the state school nurse consultant meets twice a week with school nurses who have already been asking about recovery plans for a while, and so probably a lot of you have been as well. So the recording, I'm looking at an image of Sandy Summers, who is the nurse founder of The Truth About Nursing, a branch of the American Nurses Association. They have excellent resources. They're very clean and robust, but she gives food to thought. This is about a, I don't know, maybe not fully 10-minute YouTube, if you are interested. And then I have two different nurses here. One, Jenna Palismo, on this slide, is a school nurse in Illinois, and I have her YouTube link, and she has this beautiful YouTube link that's perfect for youngsters as to, here's the school nurse on my left, wearing regular school nurse clothes, and then here's the school nurse on the right who has not really hazmat, but kind of close to it, garb on to protect for infectious disease. It's really well done. I snuck this other one on the bottom. Her name is, and there's no image, but it's Jamie Trebek, is a school nurse from Wisconsin, and she made a video for her students explaining COVID-19. I would say it's really for high school students, but it's well done, and it gives you a chance to put some language for the lay people in understanding virology. I see some great questions there, and I've left a blank slide for this next slide. Which says, what will school nursing look like after COVID-19? So I'm going to start looking at the slides, the chat box. Screening questions to be asking of staff entering the school building to get materials. So I think that is, you could use the same, because now we have to do it as health department employees. If we were to go in the building, we have to do exactly the same screening, which is temperature. So asking, I'll tell you what we're doing at the health department. We're asking people to check their temperature before they leave for work, wear a face covering, wear eye covering, wash their hands. I don't recall if they're being asked to wear gloves, but I'm assuming that's true. But there is a link for businesses, and one of your colleagues has already explored that with me this morning, and I think she really hit on the right tools from CDC. Again, it's helping people remember how the disease is spread, which is primarily respiratory droplets inside that 6-foot range, and about PPEs for for staff, I spoke to that, and the custodians would be the same. Clerical assistants would need to wait for next year's budget. I think the reason I went to the money slide from the federal and state governments is that's where some of the financing is going to have to come through the state and federal government.
So, Sharon Lee, this is Clayton. There are two questions that were posed by email that are similar to that in nature. Mm-hmm. If I can ask them now, since you're on that.
Please. Yep.
So the first one was, will the Department of Health be able to assist school districts with acquiring personal protective equipment prior to the start of the school in the fall? No school supply companies have stock and don't anticipate having more stock for at least 4 months. Mm-hmm. The second question was, our superintendent has asked our district nurses to order more gloves for our essential workers. We were wondering how to go about doing that. And I think it's back to the same thing. None of the vendors have anything, and we're schools, but we need them for the essential workers. So do you have any guidance on that?
I'm so glad you guys are asking these questions. PPE supplies for the next year, again, watch, that was that Title I conversation, the federal dollars and state dollars, that specifically spoke to funding for PPEs. For right now, I think it would be appropriate, and because there's so many people, I'm a little hesitant to leave this slide. I think I'm gonna go ahead and try to go to the health department website.
So Sharon Lee, I don't know if
it'll take a minute.
The original time we had was for 3 o'clock to be done. It's 9 minutes of.
Yep.
So I don't know if you want to try to address the questions that have been posed, or if you want to go to the website and talk about stuff.
Oh, I thought you.
Just in the thinking about how much time we have left and trying to get some of these questions answered.
Oh, I thought you just asked a question about supplies.
I did.
So I'm trying to answer it.
Okay, that's fine. I misunderstood.
Okay, so on this website there is a place to request PPEs. So I'm showing you, for those that can see, I'm on the health department website. It's been newly organized.
You're not sharing your screen right now. You would need to reshare your screen.
All right, I will share it again. I've shared it a few times, but share a window. Let's try that. Yep. Okay. Here we go. Thank you.
Sharon,
Okay.
we still don't see your screen.
Yep. It should be coming up. Thank you for letting me know. Can you see it now?
No, ma'am. I can just see the flowers.
Okay. Anyone else? It's loading. I see that it's loading. So there's a place on the website. I think it would be appropriate for your school to put in a request for PPE.
Okay, so if it would be helpful, Sharon Lee, if you send me that link, we can make sure that that link specifically is included with our answers when we post that on the VSSNA website.
Can you? Okay, feel free to start sharing. Hide stage. Okay. You want to, while this is loading, you want to ask the other questions?
Sure. So one just came up in the chat and it says, are there some simple guidelines for how to care for face coverings?
Yes, it's on the CDC website. Then that came out in your invitation. It should have been on there. At the bottom of the invitation was a list of links. So are you able to see the screen yet at all?
No, it's not coming up.
Okay.
The next
typically
question
doesn't have any problems. Go ahead.
So the next question from email is, and I don't know if you answered this, in regards to essential help childcare, our after-school staff is in charge of our school's program. What direction can you give for nurses in regards to training, delegation, responsibilities, or not?
Well, delegation is the same. Are you seeing the screen yet?
No.
No. Okay. Um, hmm. This typically shares very easily. Not sure. Yes, I will share the link for PPE. So delegation. I guess you'd have to give me a scenario. Um, Delegation, the school nurse is the expert for healthcare, so you would want to have a system where the after school program works with you to establish a regular system of communication so that every enrolled student is name and information is provided to the school nurse so that the school nurse can help the after school program learn the best way to care for that student. There should be trainings. The after school program should be making themselves available to come in and meet with the school nurse to learn how to be trained in epinephrine auto injectors, other life-saving procedures, asthma, diabetes, seizure activity, things like that. The link to the process for people coming to work. Yep, thank you. And I see a question that says many mental health organizations who are amping up their triage intake process. There was a reported teen suicide. Yes, we are aware. I'm concerned about the mental health of adolescents who are so isolated. Boy, you guys are doing some great thinking. I mean, this is the creativity and the critical thinking that needs to be happening. It's obvious from our knowledge as nurses why isolation during the teen years is really hard. So yes, the State Department of Mental Health has vastly expanded their resources. All of the designated mental health agencies are open and available. They may be practicing from home and doing telehealth, so they would be a licensed provider that would be doing telehealth. So then the obvious question of, well, how do you do telehealth if the teen's parents are in the background? So those are questions, and I've talked to a friend who does this work online, and she's worked with families to make that work. And if families are letting kids participate in resources, they typically, and the kids are learning how to go outside and talk on the phone or go find another place around the corner where their parents can't listen in. So that's a great, and Felicia's providing the link for healthcare professionals. Sorry, my phone is in the background. Other questions?
Yeah, so the next one is, have there been talks with the AOE, Agency of Education, in regards to the volunteering? Just wondering what that status is. And I think Soph touched on that a little earlier, but maybe you could respond to that.
So that's a great question. So we met Dr. Harry Chen. I'm going to try this one more time. I'm looking at, I don't know, I guess it's still connecting. So maybe you're not seeing that slide either. So we met with Dr. Chen to address the issues of workplace security and contractual issues, and then we did the survey. Thank you to you folks, and that information was shared with Dr. Chen. We met yesterday. A few of us met last night at 5 o'clock with Dr. Chen, with Jeff Fannin, a lawyer for Vermont NEA, Jeff Francis, Executive Director of the Vermont Superintendents Association, Secretary Mike, Dr. Chen is working with Secretary Mike Smith. So they're looking at the legal pieces, and I understand that Clayton will be working with them on the language around recognizing a formal contract or formal acknowledgement in writing of the school nurse being excused from responsibility or duty in the school and being relieved to participate in the surge activities or volunteer medical corps. And by the way, I can send you a new link to the medical corps if you had trouble getting on.
Yes, I
Sharon
think
Lee,
that would
this
be
is
helpful.
Self. I was going to say the exact same thing. Resending the link for Medical Reserve Corps would be very helpful.
Great.
Okay, the next question was, we have staff members at our school who are riding two in a vehicle, minivan, who deliver food to children. Close contact for 2 to 3 hours at a time, and the two individuals are not from the same family. I've expressed concern in being told that it is the Agency of Education is okay with this practice. Please advise.
So I think that has changed, and perhaps the AOE, perhaps they need to check with their nutrition program. It is a real challenge. We have a school district trying to serve 900 meals a day in Addison County. The workers have been kind of elbow to elbow. They've spread them out. They've tried to have different shifts. They're trying to be creative. It's a real challenge. And sometimes, so probably you see the buses are still running, you know, public transportation. So there are circumstances where it's just not possible to provide all of that. So if people have to be in close contact, again, it's the hand washing, it's the washing of areas, it's the wearing a face covering. If they're really spending that kind of close time, they should be wearing eye covering if they're not already wearing glasses. This is where Brina does such a wonderful job. If you get to those links that were on your invitation document, the attached document about childcare, she does such a good job about recognizing we aren't going to make a perfect situation. We're in a very, very hard times, and so just we're doing your best to come up with your critical thinking of what the best in that situation to do. Maybe they would have to use different vehicles or something. I think it would be best to save the questions for a follow-up document. I will do my best to save these. What about those of us who volunteer as nurses as our emergency management? Excellent questions. So I will try to get those out. Thank you all so much. We didn't actually get to the kind of format that people would like. If you have a minute, could you just respond whether you would like smaller groups and discussion or weekly meetings like this?
Sharon Lee, may I just say one thing about
Yep.
the VSSNA and what we have maybe coming in the future?
Thank you.
Okay, so the VSSNA, we were able to get a free license to GoToWebinar as well as GoToMeeting. So we can host a webinar of up to 1,000 people, and it would work more like what we're used to seeing with being able to raise hands and have a panel discussion and a little different access, more set up for trying to do question and answer. So our intent would be, hopefully, if people like the platform and want to try to do that, we would maybe set one up for end of next week, or maybe early in the following week to do that. And we do, I just saw someone pop up in the chat, we do think that weekly meetings, because this is so timely, would be really helpful, and that we can get the questions and maybe have a automatic send questions in, we gather them, answer some, do some online at the same time. So that would be the plan, and we really want, we would like to be able to step up that platform, but we're still figuring it out. So thanks, Sharon Lee.
Okay. Great. Thank you all very much. You guys did an awesome job. I'm not sure why this didn't share. Okay, so I have to save the chat. All right, save the chat.
And don't forget to stop recording at some point too, Sharon Lee.
I'm going to stop recording right now.